Recent studies shows that men who have sex with men, MSM, represent an increasing number of new HIV infections in Botswana. Many people in the society still hold discriminatory views against people who engage with same-sex practices. 24-year-old Mike Kidisang, who identifies himself as gay, says he often receives some discrimination from some healthcare workers. He alleges that in some instances, they are being turned away by some healthcare workers.
Ka go lephate go ba botsogo yaanong gore ke kopa thuso. One, batho ba le se nna ke se itemogetseng ka ba batla go dira ekare e nne ekare they are fine with the issues tsa bo di-gay, but nna go ya ka nna ke le one ke itemogetse gore ha se gore they are really fine, because ha o tsena kwana one thuso ya teng ha o re kopa thuso ya nna bonya, ha o re o bua le motho a teng o simolola go nna go botsa dipotsonyana tse di snacks as if kana o bolaile motho kana eng. Two, ha ba tshwanetse gore ba go thusa ngwe motho o kgona gore a ba go bolelela gore dilo a diwo, like di-condom batho ba modimo ha re batla di-condom ha diwo most of the times. When having sex re dirisa body lubricants most of the time, body lubricants are about mo spatela, so gore ha go se go spatela I have to ntsha mo pateng ke go leka go ipatlela. What if I'm not working?
26-year-old Bakang Ndaba from Francistown encouraged similar concerns, urging the government to ensure that gay men are explicitly included in healthcare policies to improve access to safe and non-discriminatory services.
I am 26 years old and I am a gay man in Botswana, Jena Francistown. So se ke se itemogetseng ga re setse re kopa dithuso tsa botsogo ke kganya gore ka la go tsena ka kgoro ka o lebiwang ka teng, not just by the healthcare workers but everyone hela gore so sometimes ya gona le gore kana re le bantsi ha re gone go ya re se gore re ikamogetse ya no se mola o e jaja pele gore ba lebileng ba ntibileng ya no go tsenya letsogo la gore so dilo go se go kopa thuso gone a me o ta gona go phuthologa sente o bua kana santse o tsile go ganyetso. So in my experience ke ga ditsone tsa gore ha ngwe o setso gore ga masepateleng o tebo o perceive ya ho tsana ka sepatela ke re ha le gore tsile o na le tshogo go phuthologa go nna dingala gore ka phuthologa, but eventually ho small how phuthologa sente ba khona go ga bona thuso sente.
Community mobilizer 𝐅𝐄𝐀𝐋𝐓𝐔𝐑𝐄, who works with gay men, says there are some of the challenges gay men are facing in Botswana.
And we have noticed that most of them keep whatever is going on with them for a longer time. If they are feeling something, for example, having an STI, they become very fearful of approaching a public hospital. What will people say? The first thing that comes to their mind: one, I'm a gay person, I don't feel accepted, I'm discriminated. Two, the manner in which gay men interact sexually. So if, for example, if they have a problem with their back area, it's not easy to come to a nurse, especially one that is not trained for a gay identifying person, to open up and let them know that I have a problem at the back, I need to be helped, I need to be assisted. They're afraid of the discrimination of their identity, they're afraid of the discrimination of the situation that they are in.
According to rights group Lekhabibo, most of the men who identify as gay prefer to seek help from health centers run by civil society organizations.
The gaps that exist within policy and law that hinder access to healthcare for gay men, not just for gay men, but for the queer community at large. Maybe the first one would be that we do not have a framework that guides access. A framework that, for example, would stipulate how healthcare providers are trained to provide services, whether it's healthcare providers or first-time responders, social worker, kana mapodisi. We don't have specific frameworks that guide their training such that they're able to respond to the specific and unique needs of gay people.
Head of Policy and Legal Advocacy, Laone van Voren, said there are still gaps that exist in policy or law that hinder healthcare access for gay men in this country.
The Ministry of Health, together with its stakeholders, and they've come up with some guidelines that we use. For example, we have even the STI management guidelines. It has portions that teach or train healthcare workers, both in the government and outside the government, of how to manage key populations, inclusive of men having sex with men.
For her part, the National STI Coordinator at the Ministry of Health, Dorcas Kanyemvu, says they have programs that support key populations, including gay men.
Well, the challenge that maybe I can think of right now is that it's not all healthcare workers who have been trained. And like you see issues of finances, like we are having now. We have guidelines, but we would love to train more often so that everyone is covered, but we have not yet covered all healthcare workers. That is, I think, a major one. And the funding now, maybe. Those are some of the main things that I can say right now. Our wish is that all healthcare workers could be trained everywhere in each corner of the country.
Kanyemvu noted, however, that not healthcare workers have received this training. She said the ministry would like to see all healthcare workers across the country trained on how to appropriately engage with and provide care to gay men when they visit health facilities in order to reduce stigma and improve access to services. Reporting for ITV News, I am Lami Lucas.